My name is Dr. Adam Farber, and I would like to present to you a video demonstrating an arthroscopic distal clavicle resection surgery. In order to understand this video, you must first understand basic shoulder anatomy. The shoulder is a ball and socket joint. The top of the arm or humerus is called the humeral head and comprises the ball of the ball and socket joint. The socket, also known as the glenoid, is a portion of the shoulder blade or scapula. There are two main spaces in the shoulder, represented by the blue areas in this diagram. The glenohumeral joint space is represented by the yellow area. The subacromial bursal space is represented by the red arrow. During shoulder arthroscopy, both areas are inspected in order to completely visualize the shoulder anatomy. Here is a view of the shoulder anatomy from the first perspective, the glenohumeral joint space. The humeral head has been removed, and you can see the glenoid socket denoted by the yellow circle. The labrum is a soft tissue ring which surrounds the glenoid socket, as is shown here by the green circle. The biceps tendon is indicated by the red arrow in this diagram and attaches to the top of the labrum. Arthroscopic shoulder surgery begins in the glenohumeral joint space. Here the top of the labrum is visualized. The biceps tendon can then be seen attaching to the top of the labrum, as is shown here. Next, an arthroscopic probe is inserted into the joint space to probe the superior labrum and biceps tendon. Then the glenoid socket, as is shown in here on the left, and the humeral head, as is shown in here on the right, are viewed. Here is the glenoid again. The cartilage appears normal in this patient. After the glenohumeral joint is inspected, the arthroscope is moved into the second space, the subacromial space. This is a space above the rotator cuff and below the acromion and clavicle. The AC joint or acromioclavicular joint is the area where the acromion and clavicle meet and is denoted by the red circle in this image. Here is an arthroscopic view of the subacromial space. The rotator cuff is the white soft tissue seen on the bottom portion of the monitor, shown here. Here is a view of the side of the subacromial space, and the rotator cuff passes over the top of the humeral head like the cuff of a shirt sleeve passes over your wrist. Above the rotator cuff is the acromion. Here is an arthroscopic view from the side of the subacromial space. The rotator cuff is the white soft tissue seen on the bottom of the monitor, as is shown here, while the acromial bone is the yellowish area seen on the top of the monitor, shown here. Deeper in the subacromial space is the acromioclavicular joint. The edge of the acromion is on the left, and the edge of the clavicle is on the right, and the space between them represents the AC joint space. As downward pressure is applied on the top of the clavicle, you can see the AC joint moving. Next, an arthroscopic burr is inserted in the front of the shoulder joint to remove some of bone on the edge of the acromion. Here the burr is shown removing a small bone spur on the front portion of the acromion to better visualize the AC joint. After this bone has been removed, the clavicle and AC joint are better visualized. Then the arthroscopic burr is inserted to remove the edge of the clavicle or collarbone. This effectively widens the AC joint space, preventing rubbing between the clavicle and acromion and symptoms related to pain in this area. When viewed from the front, after the distal clavicle resection is complete, you can see a nice widened space between the acromion on the left and the clavicle on the right. This completes the arthroscopic distal clavicle resection surgery. Thank you very much for your attention.